planned. So thank you. Back to you, Nicole.
Great. So for today's presentation, on evaluation, we want, by the end of today's training, we want everyone to be able to define evaluation, discuss the components of evaluation in regards to process and outcome evaluation, understand why evaluation is important, describe the steps to plan and implement evaluation, and view examples and case studies for evaluation. We're going to start with an icebreaker. Should be a poll in the chat. I think we need to resend it so everyone can see it. Yep, Paris just sent it. So if everyone is able to click that link and just ask them the question, why is evaluation important? And just put in your thoughts of any words or ideas of why evaluation matters. Okay, look at this. So we see the strongest word coming through is effective, but then also making sure our program works, allow us to see what we're doing, progress, impactful, implement. It's pulling out obviously just the keywords, but we'll definitely also view that to see what you guys thought. But it looks like important, tracking changes, making sure things work. So these are all really key components of why evaluation matters. All right, so let's start with the basic definition of evaluation, which is the act or result of evaluating, determination of the value, nature, character, or quality of something or someone. Yes, Ben, you don't. Hold on. Does anyone? Can I get it right hands if people aren't seeing the slides? Just Ben. Oh, a few. Okay. So Ben, you can't see the slides. Is it in presentation mode? And Harold.
Okay, I'm going to stop sharing and then share again to see if that helps, because it seems like it's an isolated problem, but I'll go ahead and stop and then come back.
Okay. Is that good for Ben and Harold? Okay. Yeah, okay, we're good. Thank you. Thanks for speaking up. It's very helpful. All right, so we can go to the next slide, Paris. So I liked this quote that I found that says, research seeks to prove, evaluation seeks to improve. So at the very core, evaluative efforts help determine if predetermined objectives related to behavior change or health improvement were achieved in a proposed health education or promotion initiative. Evaluation is also useful to improve elements surrounding program implementation, such as partnership development, fidelity, effectiveness, and efficiency, and can increase the level of community support for a given intervention or initiative. Further, evaluation contributes to our knowledge about the determinants of health issues, as well as the best and most appropriate public health interventions to address them. This knowledge is extremely valuable to guide future research and practice. Evaluation also informs policy decisions at the organizational, local, state, national, and international level. Now we're going to show, before we get started into the talking points, we'll do a quick little video on evaluation. I can hear the sound.
The Strategic Prevention Framework, or SPIF, is built on a community-based risk and protective factors approach to prevention with a series of guiding principles that can be utilized at the federal, state, tribal, and evaluation. In the evaluation phase, we want to measure the impact of the intervention and its outcomes. In this phase, we monitor, evaluate, sustain, and improve or replace those things that aren't working. The purpose of evaluation is to look for areas of improvement. With respect to cultural competence, it is important to make sure that the community is involved in all aspects of the evaluation process. Cultural competence. We want to consider.
Okay, thank you. Just a quick little review evaluation. So as another quick reminder of SPIF, the SPIF obviously includes the 5 steps, include assessment, capacity, planning, implementation, and evaluation. So for a quick reminder of all of our additional components, assessment helps us identify the local prevention needs based on the data. So sort of what is the problem? Capacity helps build the local resources and readiness to address the prevention needs, assessing what do you have to work with. Our plan and step is where we find out what works to address our prevention needs and how to do it well. So what should you do and how should you do it? Followed by implementation, where we deliver the evidence-based programs and practices as intended. How are you able to put your plan into action? And then evaluation, where we are able to examine the process and outcomes of programs and practice. So really where we're looking to see, is our plan succeeded? Next. So if we look a little further into step 5 of evaluation, the evaluation step helps communities to systematically document and describe prevention activities, meet the diverse information needs of prevention stakeholders, including funders, continuously improve prevention programs and practices, demonstrate the impact of a prevention program or practice on substance use and related behavior health related problems, identify which elements of a comprehensive prevention plan are working well, build credibility and support for effective prevention programming in the community, and advance the field of prevention by increasing the knowledge base about what works and what does not. So if we look at evaluation as in regards to SPIF, evaluation involves examining both the process and outcomes of prevention programs and practices. So we're able to examine all of our programs separately to see how they were delivered and if they produced positive outcomes, as well as how well our different programs work together as part of our comprehensive plans that address substance use in our community, as well as evaluating the implementation of the SPIF process in each of our jurisdictions. So program evaluation is the systematic method of collecting, analyzing, and using data to determine if a program is effective or not, right? And the two common types of program evaluation are process evaluation and outcomes. So when we evaluate a program, it will help to identify, like I said, if the program is effective or not, identify if any changes need to be made, report our results to stakeholders, gather evidence, and provide data that is beneficial when applying for grants. Process evaluation answers the question, did we do what we said we would do? Prevention planners use the process evaluation extensively to assess the quality of implementation, to keep implementation on track, and inform adjustments that can strengthen the effectiveness of their prevention efforts. Process evaluation assesses indicators measuring dose, reach, and fidelity. Dose is defined as the number or amount of intended units of each intervention or each component delivered or provided. You can measure dose by dose delivered or dose received. Reach is the extent to which the attended audience is exposed to or participates in an activity. Who was impacted? Did you reach your intended audience? Fidelity is the extent to which the intervention is delivered as planned. How well did our implementation activities go as planned? Next slide. So we collect all this process evaluation data. So what, right? What do we do with this data? So we want to ask these questions to help determine how things are going. We want to ask, were our programs implemented as planned? Were the resources sufficient? Were obstacles encountered? What adaptations were made? Who participated and for how long? So the data that we collect, we want to always go that next step and analyze the results to be able to see and assess how well we're doing. Outcome evaluation determines whether the program or practice made a difference, and if so, what changed. Outcomes are the changes in the audience or something that you hope will result from your program's activities. Outcome measures focus on changes in comprehension, attitudes, behaviors, and practices that result from a program, practice, or policy. Outcome evaluations can assess individual level outcomes, community and system change outcomes, and morbidity and mortality outcomes. The outcome data collected can help determine the answer to these questions once we collect the data. Did our implementation of our strategy activities make a difference? If so, what changed? By how much? What was the impact of this strategy on the contributing factor? Also, by how much, if it made an impact? So once again, we collect the data to be able to answer these questions, and that's why it's really important to identify the data that's needed to answer our outcome questions.
Okay, so let's test your knowledge. We're going to launch a quick poll where you're going to have 10 questions to respond to, whether the question is a process or an outcome evaluation question. Okay, so we're going to give you guys a few minutes to answer these, and then we will come back and discuss them a bit. And please respond if there was a question that may have tripped you up a little bit, and we'll discuss it in just a few minutes. So please take a minute and answer the poll questions. And don't worry about retaining the questions because we also have included them in the slide deck. So that when you get that later on, you'll receive it. You'll still have them. I see responses slowly coming in. How many participants do we have, Nicole?
We have
59 total.
63, but obviously our team probably is not participating.
Right, right.
So around 50, we should get around 57. I'd like to see at least more than half of people respond, so we're at only 21. Oh, it says 59 people are participating.
Mhm. Paris, we don't have to do it now, but I just realized we probably should have put 22 before the questions. That's okay. We'll do it before we send it out.
All right, who's the? Okay, here's some more people. I was
I
like,
just
"Oh
say
my
we
God."
still have some more coming through. I will give it another
Mhm.
minute or
I'll give
so.
it 12 more to answer. We see who hasn't. Well, not actually, but 81%, not bad.
Give people one more minute.
Mhm.
Yeah.
I haven't seen anything move in the last few minutes.
Yeah.
So let's go ahead and share the results. Or I guess close it out so that.
Well, they can see that how people responded, right?
Yes. Okay. So if you took the SAPS training, either if it was way back when or if it was recently, hopefully some of these questions would have looked familiar because we borrowed them from the training, because they are just really good questions to help us think about what's process and outcome as Nicole just went over it. So question number one, we had 75% of our respondents did process, and process is the correct answer for that. And that was how many individual groups did the intervention serve? And so that is definitely process. Does anybody want to like raise their hand really quick and tell us why that's process? Is anybody brave? Any takers?
Oh, we got someone.
Okay.
I'm not sure if it's right, but I felt like it was processed because it was implementing to getting to the outcome of the evaluation, if that makes sense. It was part of the information to get to the end towards that evaluation. Not sure if that's right, but
So
that was my thought process.
your response was that you thought it was outcome evaluation?
No, I thought it was process because I felt like the information that they were asking you would help you get to the outcome of the evaluation.
I gotcha. Okay. Okay. So does anyone challenge that, or? Thank you for speaking up and giving us your thoughts. Does anybody want to
Here we go. Jackie.
go ahead, Jackie?
Hi, how you doing?
Yeah, how you doing?
I just wanted to say I just thought it was simply, because process is dose and reach. So that's basically what I based my answer on because that's what it was asking.
Right. So I think it was it Delise? I'm sorry if I'm mispronouncing your first name. Decia. You were on the right track with the outcome of what you wanted, but Jackie's right that it was specifically what those individuals that we were trying to reach within the process. Okay, so number 2, and we won't go over each one, but I'm sorry, explanation for each one, but some of them we will, especially if you have a question. And if you do have a question about one in particular, please raise your hand. Number 2, to what extent did the intervention lead to improving coping skills among participants? That one was outcome. Okay. And we had 83% of people responded to that. To what extent was the intervention implemented completely as intended? And that one was process. And so that was good. That was one of the questions that's made to kind of trip you up a little bit. But remember that it's that word that as intended that really helps us to focus in on process. All right. Next slide. Number 4. How many youth participants used alcohol 1 year after the end of the intervention? The correct answer for that is outcome. Okay. To what extent did the intervention lead to change in participants' attitudes towards the harmful effects of using tobacco? That one is also outcome. How many students who were referred to the intervention actually participated? That one was process, which we did have the majority of people respond to that. So far here, as we're going through, I'm just noticing that the majority of you are, remembering and, have this process and outcome definition and recognition sort of down pat that we should really be able to hone in on the specifics of this when we go to your evaluation reports and your evaluation portion of your applications. Number 7 was another one that was made to trip you up a little bit. Number 7 asked what cultural adaptations were made to the intervention. And this one, actually, the answer was process. Again, we had the majority of people respond to this. Remember that sometimes it's not always about the results itself, it's about the process. And so that's why you have to, when you're looking at a question like this, it can trip you up a little bit because you might be thinking, oh, well, there's a certain outcome of this that I would be looking at, but you're really looking at it is a process. 8, were the people exposed to the intervention representative of the population the intervention was intended for? And that one was process was the response for that, the correct response. 9, how are preliminary evaluation findings being used to improve the intervention? And this is probably the closest one that we've had in all the responses. And again, this was another one that was meant to kind of trip you up a little bit. But the correct answer for this is process. Okay. After the intervention, number 10, did people exposed to it have more positive normative beliefs compared to those not exposed? And the correct answer for this was outcome. So overall, we had a pretty good response rate here for the questions. Again, it just sort of highlights that you guys know the information. We just have to remember to keep applying it as we are completing our either applications or evaluations or whatever it might be.
Does anyone have any questions for any specific question that maybe tripped you up or thought it went one way? Feel free to raise your hand before we move on. Jackie, okay, you're unmuted.
Yeah, I was tripped up on number 9 about, was it, what was number 9? Wait a minute. Oh, how were the preliminary evaluation findings being used to improve? I guess I would, in my head, was thinking outcome,
Right.
what
It's
yeah, it was,
so
that was
the
a little
key.
technical.
The key word here, Jackie, is improving the intervention. That's what helps to pull you back to process.
Okay. Got
So
it.
it's like we're back in school, right? We had multiple choice questions, and they would try to trip you up with some tricky terms.
Okay.
So
Thank
you
you.
may have to change the intervention, right? And so if you had to change the intervention because there was no improvement, then that's process. Does that make sense for you?
She remuted, so you're unmuted again.
Yeah, sorry, I muted myself. Yeah, that makes sense. Thank you
Okay.
for that explanation.
Yeah, you're welcome.
Any other questions for anyone? Don't be shy if you got one wrong and we want to talk it through.
And again, we did, as you saw, put the questions on the slide. So even afterwards, if you go back to it and you review them and there were some that you answered differently and you're just not really sure why, don't be afraid to reach out to your TA lead for questions and help to understand. Okay, well, no other hands, Nicole?
No other hands.
Okay.
Yeah, our break's kind of early on, but it kind of fit well. So we're not going to take a super long break, I think, because we're only a half an hour in.
Yeah.
So more of like a stretch to let it as we go into the next portion. So I think 5-minute stretch is what we'll give you guys after you did some thinking on the poll. So we'll be back at 1:40. All right, so this is getting back now into the nitty gritty of evaluation now that we have the foundation of our definitions. So we kind of want to get into why evaluation matters and how we evaluate. This is an evaluation framework that the CDC has that just really kind of walks through the process of evaluation with engaging your stakeholders, really knowing your program to be able to design your evaluation, gather the evidence, justify your conclusions, and be able to then share the lessons learned and back with your stakeholders. Just a tip that we talk about all the time to remember that evaluation is a crucial step of implementation. So really when you think about planning implementation, it's sort of within implementation, how are you going to evaluate and sort of planning that all out. Another thing is that the planning steps and evaluation are companion processes. We'll go a little bit further into this next year when we get do some recaps on logic models and all that fun stuff with program planning. But a logic model helps provide clarity on the order which activities and outcomes are expected to occur. So then our evaluation helps sort of measure how well we did those things that we expected. To ensure the best evaluation focus, you really want to understand where your evaluation questions fit into the full landscape of your program description. So that's where it's really important to know your program and being able to describe it, right? So what are the activities, goals, and expected outcomes for your program that you're implementing? And just as an FYI, program here means it can be any type of thing, a policy, a practice, a campaign, you know, any type of strategy intervention that we're calling a program. So you really want to know what is your program's activities, goals, and outcomes, as well as ensuring that you have identified stakeholders who care about your evaluation questions and will take action with your results. So this quote's really important. I think this is what we really want to focus on moving forward, is that we really need to have a healthy obsession with impact. To always be asking ourselves, what is the real impact of our work on improving health, right? So evaluation findings are used to inform program managers and stakeholders about how well our initiatives are being implemented and how effective they are at bringing about desired outcomes. So we really want to be able to show, by doing all of these strategies, look at the impact we're having on our desired outcomes. Next slide. So this chart helps sort of outline the different levels of program outcomes and effects and the hierarchy. So the beginning top of the hierarchy is more of like our process of like participation and reaction to then lead to learning, actions, change, and overall health outcomes. So it demonstrates this potential sequence. So if our program activities reach our intended participants and the participants' reactions, so their positive, hopefully positive reactions to the program contributes to them impacting their learning, right? So then through learning these things, they have the adoption of learning, then people and organizations take action, which can result in changes in social, behavioral, and or environmental conditions that ultimately can lead to the long-term health outcomes. So you can kind of see how everything sort of connects and why we measure those different levels. If we're not getting the participants or the positive reactions, then ultimately they might not be gaining the learning skills that we anticipated. If they're not gaining those learning skills, then their behaviors that we are hoping them to adopt might not be impacted. And then hopefully change into system and environmental changes, which is can be recommendations, actions, policies, and then those long-term health outcomes. Evaluations are strengthened by showing evidence at several levels of this hierarchy. So our outcome So the next steps are, how do we sort of plan and implement evaluation? I'm sure a lot of you are pretty familiar with these headers from our fun evaluation plans and applications that you've been working on, but we wanted to dig a little deeper into what are these components and how do we plan and implement these items. So our outcome and process measures address our evaluation questions. When planning your evaluation, what are the questions you need to ask? Once again, like I said before, all of the evidence-based programs have core components that will help guide the selected data indicators to measure the activities and outputs of your programs. A key decision is whether there's existing data sources, so secondary data collection to measure your indicators, or whether you need to collect new data, so primary data collection. Example of data sources that include administrative data, existing surveys, so YRBS or MPOS, pre and post surveys sort of related to the intervention itself, focus groups, key informant interviews, surveillance data, document review, such as and vital to statistics data. These are all data sources that can help provide you with data indicators to specifically answer the evaluation questions that you want to measure. Process measures are often collected throughout a program's implementation. Outcome evaluations occur when an intervention is established. They should be planned at the beginning of the intervention, as they often rely on baseline data that needs to be collected before the intervention starts. It is helpful to develop a detailed protocol for your data collection process. So I'm really thinking about, if it is primary data, developing those tools and planning that into your timeline. Next slide. So once you have your results from your evaluation, it's time to disseminate your results. This is a really important step that we sometimes forget. We go through all this effort to collect the data, answer these questions, and then who do we share it with? So the first step is really determining whom you need to communicate your results. Then figure out the most appropriate format and why, whether it's a community forum, social media, an annual report, a poll, a survey, advertisement. You want to select the best method for your result. In this guidance document that we'll be able to share with you, you can outline your communication results for dissemination. So determining who is your stakeholder and how best that stakeholder would be to communicate your evaluation results, and then planning that out. Remember that evaluation results are used to improve programs, sustain positive outcomes, and improve communities' overall plan for addressing substance use and promoting wellness. Even these are our main reasons. They can also help to obtain funding or building community awareness and support for prevention. The goal should be to get your evaluation results in the hands of people who can use them. Consider the following: brief stakeholders regularly, create a dissemination plan, select appropriate reporting formats, and help stakeholders understand the data.
So remember here that as Nicole said, when you're briefing that stakeholder, it has to be done throughout the process, right? That word regularly means that you have a consistent time that you are doing this, so that you're not waiting until the end of the project. You have to, in that dissemination plan, make sure that you're identifying who the audiences are, so that you're making whatever that is you're disseminating, or the product, is appropriate for that audience, okay? And again, with the format, as well as helping them to understand the data. We all know that you have been in situations in a jurisdiction where you might not be understanding the data that's coming to you from a source. So as the person that's disseminating the information, you want to make sure that you're disseminating it in a way that your audience can understand it and can it has some value to them. Okay. Nicole, you could pick up again, or I can continue.
Oh, you can continue to the
Okay.
to the breakout.
Okay, the last thing, just thought, sorry, was that as we're going into the case study and the activity, you really want to think about how you tailor that dissemination, okay? How your results are going to be used, how the findings are reported, what's the quality of what you're putting out there, what's the climate of politics right now in the air of who's going to receive it and how well will they receive it, and is there any competing information? Okay, so for this case study, what we're going to do is we're going to break out into groups, and you're going to be assigned in each group as you see listed here on the slide. We have 5 specific interventions or implementation activities, sorry. And so group 1 will be storage and disposal initiatives, group 2, community-based process, 3, social marketing, health communications campaign, prevention education program, and academic detailing. So you're going to spend about 20 minutes in the breakout groups, and then we will come back for the discussion. But during the breakout, you will have 4 questions. Well, really, it's 3 questions, and then you're choosing a person to give you results. But 3 questions that you're going to answer as a group based on your assigned implementation. And then we will come back and share what our results are, and hopefully give some good feedback and interaction that you all can use.
I'm going to open the rooms. It might take a second. I have to make sure that all of us are in a room, but I'm going to open them now. And then Michelle, are you still there? You can hit join for the, you need to join either room 1 or room 5, and I'll join the other. Oh, she joined the wrong room, so I'll add you, Brooke, to then room 1. Yes. All right, everyone here. Everyone can turn on their videos if they have them. That'd be great.
Well, how you doing, Nicole?
Good, how are you?
All right.
Trying to make sure everyone's in a room while also joining a room myself. All right, so we're group 5, so we're going to focus on academic detailing, which there's a few people in here that know what that is, so that's helpful. So the questions, I'll go ahead, I can put that actually here for you guys. So you can see it in the chat, the questions that we want to answer. So we're thinking about a stakeholder group that would be related to our intervention of academic detailing. And then what is the primary area of concern or interest for that stakeholder group? That would be that in regards to any of their evaluation results that you want to be collecting for academic detailing. The most appropriate format for that stakeholder group, and we can all discuss. So is there anyone that wants to be our note taker and slash presenter?
Hey, Nicole, if you can you just quickly go over what is the definition of academic?
Sure. Yeah, that can help you. So academic detailing is an intervention where you work with prescribers and dispensers, so all different doctors and pharmacists, to kind of have a one-on-one education where you're trying to implement behavior change on prescribing practices. So in regards to their knowledge and attitudes around certain opioid prescribing practices, to within Maryland's academic detailing program, it's trying to change how much they prescribe, co-prescribing naloxone, getting them more assessing for substance use disorder, and maybe connecting patients to care, knowing those services, getting bupe waivered, and then potentially prescribing medications for opioid use disorder in primary care practices. Those are the main, and so wait, hold on a second. I need to make sure that this breakout room thing doesn't close us. I need to hold, you guys can talk. I need to make sure that, why is it want to close them?
Yes, it's closing in 36 seconds.
Yeah, I need to not do that.
Yeah.
I wonder if I scheduled it I didn't adjust the timing of it, but we will rejoin, so don't worry. So you can think about these questions. If it brings us back, I'm going to leave the room and see if I can adjust. So sorry, something happened with the breakout rooms, and I'm going to relaunch them because somehow I set it up that the timing was off on that. And I don't want them to close.
Hello.
Yeah, I'm relaunching us.
Okay, thank you. It was weird. Everybody else saw it, but I didn't see it.
Yeah, I don't even know why it
Oh, if you relaunch, we'll be in different groups, Brooke said.
Did anyone actually get started?
We did.
Yeah, group 4 did, yeah.
I can,
But I guess, go ahead.
I did it as a random. Here are options. For some reason, I didn't have this. We needed at 20 minutes.
Oh, I'm sorry, Brooke. You said you were asking. Let's see. Oops.
Maybe it will. I'm just gonna open all rooms, so it's just gonna open them again. So we're good. I'm not recreating anything. So was each of us leading a room, right? So we were all spread out.
Yes, hold on before you send us so I can put this in the chat for Brooke.
Brooke, unmute.
There's the
is there any way, do you all have is there any way for us to continue to see this in the breakout room? I don't think so, right?
I just copied the questions and put it in the chat.
Okay.
I can do that right now too, as well.
Well, what the reminder is, just in case we happen to go to different rooms.
No, you're not going to the same rooms. I'm opening the same rooms again and restarting it.
What was the strategy for room 1?
Oh, I'm sorry. I just sent it, but looks like I sent it to Dr. Shia. Hold on. I just put it in the chat. I apologize.
So if you're in group 1, it's storage and disposal initiatives.
Okay.
Group 2 is community-based process. Group 3 is campaigns. Group 4 is any prevention education program.
Okay.
And
All right, we're going back in. Thank you.
all right, thanks everyone. See you in 20. Sorry, everyone. I did not adjust the timing when I was trying to do our breakout room. So now we're set for 20 minutes and not 2 minutes because that's way too short. But all right, so now we have the chat should still show everything. Hopefully you guys can see that. So academic detailing. Do you guys have any other questions about sort of what academic detailing is? It's technically an environmental program because you're hoping to change policies and practices through direct interventions with prescribers and or dispensers. So, but it is education to them, but it's not, it's a one-on-one sort of using the model of, pharmaceutical reps. There you go. So it's like going and having that like a 15 to 30-minute conversation that you're having repeatedly over time. So you kind of go through a process of almost like a mini spiff in a way, because you have an assessment to kind of assess their needs and you build your conversation around sort of where their needs and behaviors currently are. And you use a lot of motivational interviewing techniques to sort of guide them to make decisions and change and apply new behaviors. And then you have follow-up to kind of assess how well that's going and provide them with tools and resources so that they're able to adjust any of those those behaviors within their practices.
Nicole, I could tell you that in Cecil County, one of our challenges with that question is that that seems like that's an OMPP initiative, but we, so which, I mean, would that make a difference if one side is doing the education block grant, the other's doing Lowford and OMPP?
And who would your stakeholder be? I mean, it's more for, I mean, academic detailing can be done across any of the grants. If you're thinking about grant specific, there are people that have it, the funding source through through prevention. It's not only just an OMPP. There's people that are doing it under other non-OPHI grants. But we're not worried about that. We're worried about more of like as academic detailing as an intervention. And if we're evaluating it, who would be a stakeholder group that we want to, provide results with, and what are types of evaluation findings that would be important to share with that stakeholder group, as well as how would they best like to kind of receive that type of information. Anyone have any thoughts?
Can you hear me okay? Yep. I definitely think in terms of my situation, our local board of health would be one of the stakeholder groups. And certainly they would like to see the baseline data in terms of, where we are currently in relation to, I don't know, opioid prescribing and best practices and things like that. And then, of course, the outcome of seeing how that changes our focus, doesn't change our focus, but changes so that improvements in terms of, less opioid addiction, those types of things. I think that would be some of the data that they would want to look at, especially, like the drug monitoring program, prescription drug monitoring program, misuse trends, like those types of things.
One of the stakeholder groups that we work with is our local health systems. Oh, sorry, that's my light. And with OMCP, and we try to work with the practice managers, and we get information to them. And when we do work with our health systems, we work with our residency program, and they like the BUP waiver, and we hear back from them regarding, we do like how many overdoses, and we talk about peer recovery services. They like to hear about those types of things that are happening in the ED and how to help the individuals that come in and in the referral systems that need to be put into place throughout our county to help individuals with substance use disorder and how to link them to care.
So do you then track? So in terms of like the area, that's the area of concern. So then your evaluation results would show changes in those measures
Yes.
to see, like, by having maybe more, you know, by
Referrals.
educating them and then having more BUP waivered and BUP dispensed to see how that
Right.
impacts those outcomes.
Right.
So we have two different options. We can choose, what do you think, group? We have some of you that don't have phones or volume or mics. Anyone else have an idea of who we should kind of think about of a stakeholder group that would be important to share academic detail and results with? We should choose one to move forward.
You know, I'd be honest, that is one area that I am not that familiar with, Nicole. I do know that, you know, I work with our local LOFR team. And one of the things that we do is there may be, this may be a possible stakeholder is the school system in terms of the Handle with Care program, which is, you know, that's how we look at it. We're kind of focusing on the youth of those who have, you know, overdose or have died from an overdose. So again, I guess my question would be, could the school system be a stakeholder?
They might be. I don't know if they would be like probably our top stakeholder when it comes to maybe provider like education. So if you think about what are the evaluation results that you're collecting, your outcomes, it's possible. Let's me go with like one that maybe is more connected to, like, that we can easily describe, like what evaluation results would matter to that stakeholder group, and then how would that stakeholder group best, what's the most appropriate way to sort of share and disseminate results with them. So anyone else have a thought?
Yeah, so with stakeholders, everything that involves like health professional could be a stakeholder. Maybe on the state level, especially states with really high level of opioid misuse, as a health department could be a stakeholder. Social organizations, anything that working with social groups could be, if it aims to provide education on opioids in general or opioids prescription. Media might be another stakeholder for sharing the information that you could reach to provide data or information, so it could provide it to the public.
Yeah, so all of these, so okay, we have, let's take a poll. Raise your hand. All right, so should we do like sort of like at the local health board? So something like we have the state level of like MedChi, but I don't know if jurisdictions have like local affiliates that would be interested to know like what, how like this type of program is impactful to maybe get their, you know, buy-in and help with that, and a local health system to be able to share results, or any, and like, or so those are, I guess, two that we got, our two main ones. Anyone want to, which would we like to focus on for answering the other questions?
I think the local stakeholders would be more beneficial. I mean, like in our area, because they're the ones directly working with our patients that we're seeing. I don't know. Is that what you want, Nicole?
It could be like, well, Robin mentioned that there's a local board, so I wasn't sure. I don't know if that is consistent across your, like, I know MedChi is the state level, but I don't know if there's other like local boards, if that's what she was referencing in terms of like the physician boards.
Yeah, we have like a local, I think that's the same, Robin, like a local like physicians, like healthcare board in your county?
Yeah, so it varies, like our, our local Board of Health, they consist of the county commissioners. They're not, there are no physicians on board, you know, in terms of that situation. However, and really, the funding situation relies somewhat on that. But we do have stakeholders groups in terms of the local healthcare organizations. Like we have two fairly large healthcare organizations. They aren't essentially a board of health, but they do provide a lot of input in terms of needs assessment and those types of things.
Okay, so if we were to go to one of like that type of stakeholder group, what are the type of areas of concern or interest that that group would really be interested in when it comes, what kind of evaluation results would they want to see and learn more about?
Yeah, so and when we talk about our local Board of Health, definitely funding. So anything and how you can show that the impact in terms of economy, or, you know, how do these things impact our other health outcomes, like let's say, I don't know, graduation, like, you know, people who the level of graduation or education in terms of how does it impact that? Because that in turn provides funding to our county as well. So anything in terms like economically, locally, those kinds of things, or policy driven things that would rely heavily on them, you know, to formulate some legislation or something like that at the local level. Those things would be of importance to them.
So data you wouldn't need some data to show that by having more of our community members that if their providers are co-prescribing naloxone, then they have that, you know, can help reduce, you know, not like fatal overdoses. So then you're reducing like sort of that whole like continuum, or like reducing some of the additional negative outcomes by like, you know, getting people access to care earlier and connecting them with their primary care provider.
Yeah, that's definitely a big thing here in terms of the naloxone project. I mean, and we just started with a Narcan Leave Behind program, and being able to show, you know, the benefit in terms of like reducing the number of emergency transports because, you know, this, or the reducing deaths because of the Narcan Leave Behind program. Those would be important indicators to be able to show as well.
Oh, Holly, you're muted.
Also, like funds, like Robin was saying about funds associated with the amount of personnel that are in, especially for us, like if it's the board of commissioners and like EMS and like medical professionals and whatnot, but the money spent on the Narcan going on the streets, the Leave Behind program.
Oh no, we're doing academic detailing.
Yeah, that's
okay.
Yeah, that's what they would want to know.
Okay,
like
yeah.
the physicians, like how much money, because we do have physicians that sit on our local board, but like what does that look like for our county financially, like Robin said? Like where does the money point in and how does that money funnel out?
So for that stakeholder group, how do they like to, what's the appropriate format to sort of share these types of evaluation results with them? How do they like to receive data?
Yep. So in terms of the Board of Health, I have to, it's actually mandated that the health officer has to give a presentation and an update to the Board of Health twice a year. So the very first one that I ever did, I think it was actually in October, essentially was a presentation during a commissioners meeting. So I had to be formally put on the agenda. And then because, you know, it has to be recorded that it was completed. So yes, a presentation in terms of that situation.
Presentation form.
Okay.
Sorry, I'm off camera because I'm eating. I'm
That's
sorry.
fine. All right, so Virgil, have you been taking this down? I feel like I've been seeing you write in these notes. So you're.
I was taking it down so I can learn a little bit more. I'm learning from the experts here. So
Yeah, well, you're also taking it down because maybe you might be our share. I feel like you like to share. But I guess we have a little bit more time. So if we think about, if anyone has another idea of another, like a different stakeholder group, but that type of data they might want to, we don't have to share both, but just in terms of discussion, like if we looked at a different stakeholder group, what type of data that would be helpful to them, and like how would be a better, like a format to be able to share results with that stakeholder group.
For Dorchester, a stakeholder group for us would be our OIT or our OOCC. They are the Opioid Operation Command Center and the Opioid Intervention Team. So obviously, if there's a change in the prescriber and physician prescribing, they would definitely be interested to know what that is, what that looks like.
How long are you going to be here, Carla?
Okay.
So I guess a format, I don't know I don't know how the data should be formatted to present to them to show that conversations are being had, or
So you think they would like the process stuff or more outcomes?
yeah. Well, it would be both, because the process of how it would be both. Exactly. Yes.
Okay.
How many providers we're talking to, how often we're seeing them, how long we're having the conversations, but the outcomes would also be, has there been a reduction in the number of prescriptions they provided, or the amounts, like if did it go from a 60-day to a 30-day, or 30-day to a 10-day, a reduction in overdoses or suicidal attempts. Yeah, an increase in our,
because you can then highlight your key points with some like infographics and sort of like bolden the key points, and then they can take it away to see the impact.
Also, like an increase in the use of our drop boxes, like they're already being used, but to see an increase in that would also be an indication that hopefully some information is getting across.
Yeah,
to
those
dispose
conversations
of,
are happening.
Mhm.
Okay, that's helpful. Anyone else just thinking about it? Justin, you're new to detailing, but have you thought about who's a stakeholder group that you think might be interested when you actually start this intervention yourself?
Honestly, stakeholder group wise, no. I've primarily just been focusing mostly on just clinicians. So I feel bad. I have not even given thought to that yet.
It's okay. Just thinking about detailing, who do you think might benefit to learn from once it, like some of how the impact of that will go? I mean, your coalitions could be a stakeholder group. So just even.
The coalitions are stakeholder groups?
Well, or some, dependent on how integrated they are to the intervention, right? So if you're just, they can be considered a stakeholder group, right? Your community, the community level, if you wanted to share back with the community, what are you guys working on? Those are, I think sometimes we forget, like just promoting our work. Remember, one of the goals for evaluation is to show what prevention's doing and how it can work, sort of build that community support and getting more people interested in our efforts.
Okay.
So, yeah.
Yeah, so harm reduction coalitions could be one.
Okay. I'm just gonna assign these people randomly. Okay, and anything else when you guys think about,
Yeah, I tell you, Nicole, if you don't mind, I'm really surprised by the question because our focus is primarily on primary prevention. So I see you looking at harm reduction, looking at how our stakeholders who are related to and work in that area. That's an interesting concept for us to be making that shift to. So I don't know. That's something I'm thinking about. You got my head wrapped around. I mean, how do we go from primary prevention to overdose and overdose deaths, and that's a whole different shift. So I don't know if that's a SAMHSA thing or a MDH thing. It's something that I'm trying to wrap my head
it's
around.
both academic, I mean, like, we're not doing only one intervention, remember? And so with academic detailing, there is some primary prevention side of it. If you're talking to providers, that if someone's just getting their first prescription for an opioid, right? And then they're changing the practices and having conversations, you're essentially preventing maybe a misuse of it or misuse of someone else because all right, do we have enough time to discuss this time for all the groups? We good? All right, so Michelle, back to you.
Okay. So we should have one person from each group that volunteered to share results. So we'll take this time to let everyone, we'll just go in order of groups. Let's see. And then if you have any questions or anything as the representative is talking, we can take questions right after each group, or we can do it at the end or have some discussion on if anybody wanted to add anything, or if there was something that worked better for you that you wanted to add to the discussion. So let's start with group one, which was storage and disposal initiatives. Is that Nate? Can you unmute him, Nicole?
Yep, let's use my, yeah. That for the other groups, just raise your hand and I'll unmute you. Okay, Nate, you're unmuted. Oh, you should be able to unmute yourself.
Yeah, there we go. A button popped up. Thank you. We had a good discussion. We kind of looped around to a bunch of different topics. So I know we're only supposed to have one stakeholder group, but we did end up talking about a bunch. But we ended up kind of focusing in on the community, and we kind of focused on like parents and the elderly as we talked about the community in terms of stakeholder group, just general citizenry. So our primary areas of concern for this stakeholder group are just pharmaceuticals that are given to parents or the elderly being diverted or misused. Are they being stored properly? Are they being taken by either children or grandchildren or things like that and misused? Lack of knowledge base. Someone mentioned that people can get upset sometimes if they paid for medications and they either expire or don't get used, and then they're kind of suggested that they're supposed to get rid of the medications, and how to kind of educate people to deal with that. Being upset about I paid for this, I should be able to keep it forever and just throw it in my closet or whatever. We talked about access to the resources, which includes access to drug disposal boxes in the community where they can drop off medications, access to things like deterra bags for at-home disposal solutions, access to lock boxes for safe storage, especially of controlled substances, and then of course access to information. And then when we talked about evaluation and how we would go about that, we would be doing quantitative evaluation of kind of outcome evaluation styles for the things like the physical materials distributed through the community, such as like the Terra bags, the amounts of lock boxes, and like things like amount of brochures or information given out. And we talked about process evaluation for things like outreach and expanding kind of community center stuff like disposal boxes in the community and things like that. Those would be more of like a process-based evaluation as you kind of expand access without necessarily having the hard data of how many people have used each lockbox and things like that. And then outcome-based things for drug disposal actually events where you have like the hard data outcome evaluation of, you know, how many pounds of medication or syringes or things like that dropped off during the events. And then we talked about reporting back to the community. We'd be using press releases, newspaper articles. Someone had a good idea where it was use the announcement and the advertisement for the next upcoming event to report on the data of the last event and all those kind of outcomes. And then social media posts through campaigns. And I'm sure I've missed some stuff if anyone else from the group wants to pop up.
If anyone else wants to talk, raise your hand. I guess Mindy was in your group. Mindy said you got it, so you're good.
Nice. She was also taking notes. So.
Awesome. Does anyone from any other groups have any questions for this group?
Okay. Group 2, community-based process.
That's Ben. I'm unmuting you, Ben.
Can you hear me?
Yep.
All right. So for community-based processes, we talked about our stakeholder group being parents and caregivers of youth. One stakeholder group we actually kind of forgot to mention was the actual youth itself. So making sure the youth were involved in any discussion and planning. The primary area of concern or interest for the stakeholder group, specifically to relation to the evaluation results. So we were talking about availability or access to alcohol or non-medical use of prescription drugs. So we talked about showing, results. Well, we didn't really get into the meat of it, but just showing the results of, decreases in, non-medical use of prescription drugs, decreases in underage drinking, and the appropriate formats of sharing these results will be through PTA meetings, social media posts, infographics, school newsletters, and just those opportunities to, really get in front of people and simplify the message to them in regards of the results and things like that. So that was the majority of what we talked about. And then we got into a discussion a little bit about academic detailing as well, because Todd had brought up the question of the first 3 questions and how it fits in regards to academic detailing. And there was a lot of sharing in there. I didn't take all of those notes, but there was a lot of sharing in there that went on. And Paris actually was able to give us some insight from some information she had as well. So,
great.
thank you.
Well, thank you. When we get to group 5 on academic detailing, feel free to add any additional thoughts for what you guys came up with.
Oh, no need. I'm going to allow that group to do their thing. So sit back and listen and learn like everyone else.
Any questions for Ben with the community-based process? Okay, moving on. Group 3, social marketing and health communications campaign.
All right, Sandy, you're unmuted.
So what we looked at as far as our stakeholders were clinicians, physicians, basically healthcare workers and hospitals. And the primary area of concern or interest had to do with communication with patients and basically clinicians and how much of that communication there was. And what we thought we needed to do as far as the area and how we would do that would be through social media campaigns, ads, billboards, any type of a visual type of thing that we could do to get that information out to them, even things within the newspaper. And then to kind of judge as the outcome was, and what we want to try to do was to see how we did with improving communications between the patient and the healthcare providers, healthcare workers, that kind of stuff. So what we look for is positive changes that happen within the community, increased communications between healthcare workers, clinicians, and physicians. We also looked at the social media campaigns as far as number of clicks, the sharing, that kind of stuff. And then also even a focus group within the population, just to see what the outcome was and if they had picked up on any of that. And then, of course, the question was, what do we do with the information once we get that? Who is the appropriate audience to communicate this to or to report this to? We said that it was important to report this back to the medical, so to the clinicians, the healthcare workers, that kind of stuff. And how we would do with that would be with the medical associations, hospital boards, boards of directors, maybe coalitions that they worked with. But we also felt that maybe it should be done in two formats when we do this. For physicians, we needed to also make sure we did them, but as well as making that information available to patients and those that are that communication portion. So for physicians and clinicians, we thought like a one-page paper with infographics, because we know that we're not going to have that much of a long of attention span for them. They want something that's quick to look at, give them the information, and then move on. But then also we talked about having a physician who could help us do to gear that in to speak basically their language, so that when they looked at it, they understood it, and it was something that was easy for them to read and more in their language and not ours. And then we also wanted to make sure that we had the ability to share this information that we got for the stakeholders, to pass that on to the patients. So we wanted to make sure that's something that was easy to pass on to them, maybe even a one-pager as well, and to do that. The reason why this was so important as far as this whole campaign was we were looking at outcome improvements. What we wanted to do is we wanted to try to stimulate a change within the community, within the population of healthcare workers and physicians and clinicians, as well as that ability to build that bond between communication between the patients and those healthcare providers. And we also talked about, what works and doesn't work, and some of the ideas. We talked about some things that happened within other things and a way to get across to others. The biggest thing is we want to get community buy-in, and we also want to get the physician buy-in as well. So if we get that buy-in from the healthcare workers, clinicians, and physicians and stuff like that, we build that trust factor between, us and them, and then we then invite them into other campaigns that we have, things that have happened before, where once we introduced one thing, they joined in with some other things. And then we also want to make sure that we're also reaching that higher population. So like we talked about the board of directors, the CEOs of the different organizations, whether it's the hospital, the clinicians' offices, and then making sure how we get this information across to them. One-on-one is always good if you have providing that information ahead of time, possibly, so they have a chance to kind of glance at it, look over it, but then spending that one-on-one time with them. Again, like with academic detailing, that could be a very important thing, where you're in doing an academic detailing and can provide this information as we do with other things to them. And then also sharing at meetings, whether it's medical association meetings or something like that, and sharing that information with them and getting that across. The key thing of this campaign would be to increase communication between, healthcare workers, clinicians, and the patients. If I forgot anything, somebody will have to jump in.
I don't think you did. This was my group. So there was they did a really good job of sort of taking a step back and thinking about, and I think it's a good reminder that we have to go back to thinking about, okay, what exactly do we want out of the evaluation, right? What are the actual results and things that we're looking at to measure? And then why is that important to somebody else, and then how do we translate it? So great, thank you. Group 4 was prevention education program.
All right, James, I unmuted you.
Thank you. I'll have to say did not volunteer. I was voluntold that I was going to be the guy to report out. So I will do that. And if anybody needs to add anything in, please do so. So when we talked about prevention education, I think the one thing that kind of came up the most in our conversation was things that related back to the school system almost. We talked about decision makers and community, all sorts of different things. But the one thing that I think that I was like, I overheard the most was related more to the school system. But again, decision makers and parents and other things were mentioned. So what's the primary area of concern or interest? We kind of boiled that down to prevention of what I heard was drugs, alcohol, tobacco in the underage kind of setting, because we talked a lot about, or I heard that things like life skills and programs like the after school programs and those kinds of things. So in that area of I guess, for those stakeholders of those concerns, it boiled down to those kind of things. And so as far as the most appropriate format for reporting and evaluating, this is where we heard a little bit more than in the other areas. And what we heard was that it could be done in multiple fashions, like PowerPoint presentations and those kinds of things. And then I had shared that in our jurisdiction, through health education and outreach, there's an annual report that breaks everything down from obesity, tobacco use, alcohol use, opioid and prescription misuse. And that's like a document that is shared out with all of the outcomes from the community impact and through the data collection, which is done through after school programs or work sites or even through the schools. And it's kind of relates back to a strategic plan. And then we also talked that maybe an appropriate place to share this was someplace where the public would have access to those outcomes. So it might be some sort of website or something where it was like an open source for public health. And in Garrett County, I had shared that we have something called My Garrett, which is it's an open source for public health software. And so there are over 2,000 planning partners and over 150 groups, and everybody puts their outcomes of their data on there so that the public can see it and utilize it almost like a resource guide.
Good. Thank you for that. Michelle, did you have anything to add for this group?
No, I thought that was good. I don't know if anyone else, thanks, James, even though you were voluntold.
I think to remember, obviously French education was the broad category. So you guys mentioned life skills. That's definitely important when thinking about the specific prevention education, what evidence-based curriculum program you would be implementing, really understanding that program's outcome measures and goals and activities for that you're collecting, and then determining which of those would be beneficial to share for each group. So like, obviously you mentioned like some of the long-term on use, but what about, there's also some of the immediate sort of like skills that are gained maybe through life skills that also might benefit showing, because there is that connection to education. If you talk about like people being able to cope and some of the other life skills outcomes, the schools might be interested in those outcomes as well. All right, so we have
last but not least, it was group 5, which was academic detailing.
Yes, this was our group, or my group, our group. So I'm gonna have Virgil talk, and then Sam, you do Virgil. I offer. You were taking notes.
Wow, that's you put me on the spot there, Nicole.
I'll help fill in the gaps. Don't worry.
All right, great. Well, how's everybody doing? Listen, the notes I've taken is that some of the stakeholders that were were described was the local health systems and the local board of health, I guess, which is is the local health systems that are stakeholders, as well as OIT and the OOCC. That's also our stakeholders. And particularly looking at indicators such as overdose deaths and overdoses in particular. But again, I was spending most of my time trying to understand academic detailing and how it relates to primary prevention. And I think that's where we got cut off, Nicole. And you said that we will be able to discuss later on. I do know that one of the stakeholders that I had brought up was the school system because of, again, with our handle with CARE project in Cecil County. That's something that we're very, very interested in, as well as we think, and I like what Ben said earlier, that our youth are stakeholders as well, because again, our youth is part of the our plan and part of our solution. So, with them being able to get training and RX and over-the-counter medication training, they have an interest in this area as well. But from a primary prevention perspective, I was very, very limited in terms of how much input I would have in this discussion before we got cut off.
That's all right. I'm going to bring in Holly. I'm going to unmute Holly to kind of fill in the gaps of the whole discussion that we were having.
Oh, geez.
I told you guys that you were share. I guess, I mean, I don't want to fill in, but I saw you guys, someone was taking notes, but I guess not really. So you can just share what the outcomes and
Sure. I don't remember the other girl's name. Robin.
Left, or else I would I have her.
Oh, okay. So some of the stakeholder stuff that we shared was, they really look at, there's a lot of physicians that sit on our community boards, especially our in my county, there's physicians, EMS, first responders, county commissioners, and they want to see how the impact of, Narcan distribution, how Narcan marketing, how Talk to Your Doc campaign goes. They want to see numbers and how numbers benefit the community. They want to see that. And I think numbers are an impactful way of showing even physicians what works in our county and what doesn't work in our county. And some of the stakeholders, like Virgil was talking about, if you show them through PowerPoints and the collection of data. I know Robin was talking about how she had to do her presentation for her health officer and reflect the numbers of whatever their campaigns were and what numbers they wanted to decide to show their stakeholders. But another thing Virgil brought up in our conversation was, as preventionists, and I know Virgil is a huge preventionist, how do you look at Narcan and overdose and that type of thing at tertiary or the first level of prevention? And like Nicole was sharing, you may have a first time RX patient holder of an opioid, and you want to explain to them how to, keep them safe, how to lock them up, how to talk to your doc about taking them. So that is the first level of prevention with that. And that's some other, that could be a campaign of first level. So we talked a lot about different things in our group, but and what stakeholders would really want. So our stakeholders were the doctors, the residents of our local health systems, getting them bupe waived so that they can prescribe buprenorphine to their patients, finding out what medicine for the community has the higher success rate and, getting those doctors aboard. So there's a lot with academic detailing. It doesn't always have to result around the outcome of opioid overdose or like a substance use disorder. It could mean that you talk about co-prescribing naloxone and safe storage and how to do that. But yeah, that's pretty much the gist of what we spoke about, I think, in our group, right?
Yeah,
Nicole?
I can fill in some gaps. So I think we definitely got talking to different stakeholder groups, and we tried to then just drill down to one. And so when we were talking about this, like a local health board, one of the main evaluation findings that were of interest to that stakeholder group is sort of like the cost and benefits of a specific program. So like showing that, collecting that evaluation outcome data, but then how the showing those changes in outcomes, how that can have a cost benefit for the county or the jurisdiction. So tying the data to numbers, to like money, is really important to certain stakeholder groups, and showing that investing in this program has long-term impact and also cost savings benefits. So that was what we got from detailing. I don't know if group one wanted to add anything. They can type it in the chat and I'll read it if you don't feel like you have to talk again. But since you guys did talk about detail, or group two, right? Group two talked about detailing on your own. Was there anything else that you guys thought of?
Don't be shy. Ben said y'all had a lot of discussion. It might be a thought or an idea that someone else can use.
So hello everyone. So the conversation that we had about academic detailing only reinforced what I thought I knew about academic detailing, about stakeholders, about who we would report our results to. So it was certainly enlightening for me to have that affirmation of what I thought I knew and what I've been taught by my colleagues at the health department about academic detailing. So what was shared here in the group with group 5 just kind of reaffirmed what our discussion in group 2 about academic detailing. So thank you.
Great, thanks for sharing. Back to you, Michelle.
Okay. Well, first of all, thank you all for your participation. I think we all value having some time to have some discussion with each other, and especially for you all that are actually implementing these programs that fall under these headers, that it's helpful to hear what other people are doing and what works and what doesn't work. So remember that a successful evaluation adheres to the 4 principles that you see here. So everything we talked about today sort of falls into these categories: utility, feasibility, propriety, and accuracy. So utility, when you're talking about utility, it's about making sure that the evaluation meets the needs of prevention stakeholders, including your funders. To increase the utility of the evaluation, prevention planners really should think about what you see listed here on the slide: identifying the evaluation needs of all key stakeholders, documenting your findings so that they're easy to understand with all audiences, and share your findings with stakeholders in a very timely manner. Feasibility then takes us into making sure that the evaluation is realistic. Is it doable? To ensure feasibility of your evaluation, you have to think about establishing data collection procedures, anticipating, right? And addressing potential obstacles. Consider your efficiency and cost effectiveness. I think somebody said that regarding one of the, I think maybe it was academic detailing, and about how important that was, looking at the cost effectiveness of something. Propriety, right, is really looking and making sure that your evaluation is conducted in accordance with legal and ethical guidelines. It's consistent with each community's cultural context. So to support propriety of evaluation prevention, you should respect the rights and protect the well-being of all those involved. Examine the program or practice, and then define how the findings will be disclosed and who can access them. And finally, it's accuracy. Making sure that your evaluation is conducted in a precise and a dependable manner. You can increase your accuracy by clearly describing the program or practice, gathering and using information that is both valid and reliable, systematically and appropriately analyzing all information, justifying and fairly reporting all conclusions. And I would add to that, reaching out for help when needed. So if you're not sure how to do those things or how to actually apply them, a part of us being, at the compass of all this, being having utility, being feasible, being propriety, and having accuracy is also reaching out for help when needed. Because sometimes we forget, sometimes we may not know, maybe we're new to the field. It's okay to ask for help. Okay. And last but not least, any questions? You guys did some great discussion today that we came right out in the hour. Any questions? Anybody just raise your hand, I guess, right now, if you have any questions before we wrap up. I like those little bubbles.
I don't
No
see
questions, no hands?
Anybody? Any overall questions, any of the content we covered today? Okay. All right.
Okay.
Feel free to reach out if you have any questions after.
Yes, and we'll be sending the presentation as well as, resources attached to it that have to do with evaluation. Again, as you look through them, if you have questions about them, make sure that you reach out. The BERT team is here to help.
All right, thanks everyone.
Thank
We'll
you.
share this recording and all the resources and slides via OPHI to you guys. Everyone gets them.
Have a
And
great day.
thanks.
Thank you.